Having seen the clinical scenario, we shall now try to understand the concept of hypertension, or basically elevated intra-arterial blood pressure. Right? Why are we worried about high pressures inside our arteries? To understand that, let's first look at why does the blood pressure increase within the arteries. Please understand that when we are born, these arteries throughout our body, they are highly elastic. They have a phenomenon of expansion when the blood is pumped into them. So blood does not flow into rigid blood vessels, but each time our blood vessel, our heart contracts, the blood vessels that receive this blood will expand because they are elastic in nature. With age and due to numerous other factors, we lose this elasticity as time passes. Let us start by looking at some of the risk factors that cause the loss of elasticity. The well known risk factors for hypertension can be classified as modifiable and non modifiable risk factors. The non modifiable risk factors are age. Naturally, with increasing age, there is going to be increased stiffness of arteries, loss of elasticity. Family history and genetics are important because it's quite evident that hypertension runs in families. Now, if you look at the common modifiable risk factors, atherosclerosis, a condition that we discussed in the past, dyslipidemia, diabetes, smoking, obesity, and high salt intake have clear-cut relationship to elevated blood pressure. How these risk factors lead to an increase in blood pressure and what are the pathophysiological outcomes of having elevated blood pressure, we shall see now. The various risk factors for hypertension that are both modifiable and non-modifiable lead to atherosclerosis and loss of vessel wall elasticity. Over a period of time, this loss of vessel wall elasticity and increased perfusion pressures in various organs will lead to changes in multiple organs. The most classically affected are the cardiac muscles. The cardiac muscles, because of the increased blood pressure, undergo hypertrophy, especially the left ventricle. The left ventricle hypertrophies and the left hypertrophy can lead finally to heart failure. There is heart failure with preserved ejection fraction and heart failure with reduced ejection fraction. The common two classifications of heart failure both occur as a result of left ventricular hypertrophy. Increased demands of the left ventricle also lead to coronary artery disease or ischemic heart disease, and you have complications like myocardial infarction. The second major organ system that is affected is the central nervous system. Increase in blood pressure can lead to cerebrovascular accidents, both ischemic, which is more common, and hemorrhagic, which is less common. Okay, so you have ischemic and hemorrhagic strokes. It is the combination of coronary artery disease and cerebrovascular accidents that we commonly call atherosclerotic cardiovascular disease, because these are the most common causes of death in patients who have hypertension. Cerebrovascular accidents aside, you can also have, because of the obstruction of small vessels, you can have a condition called multi-infarct dementia or vascular dementia. We'll touch on this when we discuss our dementias. Sometimes there is also a sudden increase in blood flow to the brain due to loss of autoregulation, and this causes
what we call an acute hypertensive encephalopathy. That is an acute hypertensive encephalopathy. Okay, acute hypertensive encephalopathy. So these include conditions like malignant hypertension, accelerated hypertension, which we will touch on later. Now, other organs that are involved are the kidneys producing nephropathy. In case of nephropathy, initially we see leak of proteins, that is microalbuminuria, which we usually determine by looking for a urine albumin creatinine ratio. Sorry, let me just correct that. There is a urine albumin creatinine ratio. There is an albumin creatinine ratio, and if this albumin creatinine ratio is between 30 to 300, we say that it is elevated. This state is called microalbuminuria. That is because of increased filtration and leaking of proteins. Over a period of time, these proteins start depositing in the glomeruli, producing what is called glomerulosclerosis. And the cause of renal failure in these patients is often glomerulosclerosis. Other organ systems which are less commonly affected but equally devastating can include your retina, where you can have hypertensive retinopathy. There is hypertensive retinopathy, and the atherosclerosis is particularly pronounced at areas where large blood vessels divide into two, particularly the iliac arteries. Atherosclerosis at the iliac arteries lead to decreased blood flow to the lower limbs. This will be shown. This is what we usually call peripheral vascular disease. Okay. A good way to screen for peripheral vascular disease is to look for the ankle blood pressure and compare it to the brachial blood pressure. So normally the blood pressure in the ankle is higher than the blood pressure in the brachial or in the upper limb. So when you do something called an ankle brachial index, that is ankle blood pressure divided by brachial blood pressure, in normal individuals it is definitely more than 1, but in people with peripheral vascular disease it is less than 0.9. So this is another use of blood pressure to screen for one of its complications. So this is summarizing all the complications that you can see in a patient of hypertension, cardiac, the central nervous system, hypertensive retinopathy, nephropathy, and peripheral vascular disease.